Hey, hey. Welcome, everyone. Welcome to Baby Talk with Dr. Andrea. I'm your host, Dr. Andrea. I am coming to you guys live from cloudy and rainy Central Florida. We are definitely starting to feel the effects of Hurricane Michael here, but certainly not as much as they are feeling it up in the Panhandle. Certainly we are praying for them. I hope that people that were recommended to evacuate did do so that they are safe. And we'll keep them in our prayers, and hopefully that storm will head out soon. Hey there, welcome. Thank you for joining. So we're definitely rainy and cloudy here, but I wanted to come on and talk with you guys tonight about a pediatric topic. And as people are joining in, we'll get started with that. If you know anyone that wants to know about this topic, it's a big topic in the news that we're seeing a lot lately. Feel free to tag them, to share this video. If you have any questions about the topic, go ahead and drop a question in the comments. And I'll handle it during the talk or afterwards. But again, I am Dr. Andrea. I am your board certified pediatrician and newborn expert. I teach new and expectant parents how to care and prepare for their newborns. But again, tonight I'm talking with you guys about a general pediatric topic, hand, foot, and mouth disease, the top 5 things that parents need to know. So let's go ahead and get started. So what is number 1? What in the world is hand, foot, and mouth disease? People hear about it, they don't know what it is, they worry about it, so let's kind of clarify that mystery. So what is it? So hand, foot, and mouth disease is actually a common childhood illness. You can see it actually more commonly in the summer and fall months, which is why we're hearing a little bit more about it now, and that tends to be in the cooler climates. But if you live in a warmer, more tropical climate, you can actually see this disease occurring year-round. It is usually or most commonly caused by the Coxsackie A16 virus, but it is caused by other viruses in the enterovirus family, so you could actually get this virus more than once, or this illness more than once, which is what I get asked about a lot. Some people feel you get it once, it's done. No, unfortunately, you can get it a few different times, but most commonly with that one virus, okay? So the next question is, if I get this illness, what does it look like? How would I know? How do I know if my child has this? So number 2, what does it look like? So typically when you get the hand, foot, and mouth disease, it starts out with a fever, more of a low-grade fever, usually under 102 Fahrenheit, and it typically only lasts for maybe about 2 or 3 days. Following that low-grade fever, you typically start to see some blisters or sores in the mouth. They can be all throughout the mouth. They can be quite painful. You can also see that traditional rash with it, which is typically like a tiny red bumps or tiny water blisters that can be around the mouth. It can be on the palms, the soles of the feet. It can actually even be in the diaper or the butt area as well, and that rash can be painful. Other things that you see with it, what you see with other viruses, are going to be you can have a runny nose, you can be coughing, you can have a sore throat with it, and you can feel more tired than usual. So these are your more common things that you'll see. Less commonly, in a more severe version of hand, foot, and mouth disease, you can actually see where the fingers and the toes start peeling actually, or you may actually see that the child has some brokenness in their nails, or they actually lose the fingernails or the toenails, and this can actually occur weeks out from when you actually had the illness itself. It's nothing to worry about. It's a benign thing that can happen, the peeling and then the loss of the nails. But it can take several months for those nails to come back in, but in general, they should be expected to do that, okay? So that's typically what the disease looks like. So the next question is, who gets this illness and how do they get it? So most commonly, hand, foot, and mouth disease is going to show up in children between the ages of 6 months old and under 5 years old. But older children and adults can certainly get this illness as well, okay? So how do you get it? Basically, when you have that runny nose, that cough, you can spread the illness through droplets in the air when you're sneezing and you're coughing with that runny nose. And if you have drooling and you rub that area, you touch something else, or you're blowing your nose, you touch something else, you can spread it that way when someone else touches that and then touches their own face or their mouth. The blisters that you see on the skin that have fluid in them, that fluid is contagious as well. And it's also important to know that when children have this illness, or adults even, when they go to the bathroom, the stool actually has the virus in it as well, okay? So you want to be cautious about that too. So then the next question is, when you come into contact with it, how long does it take for the illness to show up? That's number 4. And then how long are you actually contagious? So 4, how long does it take to show up? And then how long are you contagious? So hi there, thank you for joining. So when you come into contact with it, typically about 3 to 6 days later is when you should start seeing some symptoms of the illness that we talked about earlier. Then how long is it going to be contagious? So usually that first week is when you or your child is going to be the most contagious. That's when you're going to have the fever going on, you're going to have sores in the mouth, and the rash on the body. But once that fever has resolved, the sores in the mouth start healing up, and that rash starts drying up, you're going to see that it's improved a lot. But if you come into close contact with a person that has the illness around that time, they could still spread it, especially if you're sharing utensils. And then keep in mind also that even though they're less contagious, with coughing and things like that, they can still actually spread the virus in their stool or their poop for several weeks, okay? So the last thing, number 5, is what can we do to prevent this or treat it? So unfortunately, there is no treatment for this. So there's a lot of viruses that we just don't have a treatment for, and because it is a virus and not a bacteria, you can't use antibiotics to cure it. So the 2 things that you typically focus on is going to be making the child or making yourself more comfortable. So it can be painful, as we talked about before, so you can use Tylenol to treat the pain. You can use ibuprofen, and children that are 6 months and older will be more appropriate. And that can help with the pain symptoms. You also want to think about the fact that because they're having pain in their mouth, those blisters, a sore throat, they may not want to drink. That's usually the biggest thing that we run into. So you have to make sure that they are drinking lots of fluids and staying hydrated so they don't get dehydrated. You want to avoid things that are like hard foods, anything that's really acidic. So you don't really want to do tomato sauces and lemonades because that may burn and sting. So something that's more comfortable, cooler things I would offer to them, like little popsicles and things like that may numb the mouth, okay? And then as far as more severe cases where the child maybe is just refusing to drink because they're in so much pain, doctors sometimes prescribe something called magic mouthwash, which is a concoction made of different medications. Some versions don't have any lidocaine in it. Other versions do have lidocaine, so you have to be cautious because you don't want to swallow lidocaine. That's for older children. But if you feel that your child is having a really hard time, maybe getting dehydrated, talk with your pediatrician about magic mouthwash, which they can possibly prescribe. Okay? And then the last thing is, what can we do to prevent it? Well, the biggest thing that you want to do is hand washing. So that's how we keep from catching a lot of the illnesses at the office, is washing our hands. You especially want to be washing your hands after changing your baby's diaper, because remember, the virus can be there for weeks. And encourage your child to wash their hands after using the bathroom. If they're blowing their nose, wash those hands as much as possible. If you have other people in the home, try to keep that sick child in a smaller area of the house so they're not touching everything everywhere else. Make sure that they're not sharing drinks. Hey there, thank you for joining. It can be pretty awful. It can. My niece had a pretty bad case as well. It was pretty tough on her, for sure. So that pain that they experience can be pretty bad. So that's why you want to make sure that you're treating their pain as much as you can, and then asking about that magic mouthwash if you feel that it's appropriate. But definitely hand washing is important. You want to make sure that you use like an antiviral spray, like Lysol is one brand, but there's other ones out there. And just make sure that you're cleaning throughout the house throughout the day. Keep some hand sanitizer for people that it's appropriate to use. And then again, hand washing, okay? So again, just a recap, I'm talking to you guys about hand, foot, and mouth disease, the top 5 things that parents need to know. Number 1, what is it? It is a viral illness that's most prevalent in the summer and the fall in the cooler climates, but it can be year-round in other places. You can get it more than once because it's caused by more than one virus. What does it look like? Usually starts out with a low-grade fever, less than 102, lasting for a few days. You can get sores in the mouth that can be painful. You can get a reddish, bumpy, watery blister rash on the hands, the feet, the diaper area, around the mouth as well. You can get cough, congestion with it, sore throat. They can feel very tired. Who gets it? Typically your children that are going to be between the ages of 6 months old to 5 years old, but yes, older children and adults can get it. Typically after being exposed to it, it takes about 3 to 6 days for symptoms to show up. That first week that you have it is when it's going to be the most contagious, until the mouth ulcers are healing up, the skin blisters are starting to dry up, and that fever is gone, but certainly you can still spread it, so be cautious, especially in the stool where it can hang out for a few weeks, okay? And then you also want to remember that we don't have a treatment for this, unfortunately, because it is a virus, but you do want to try to keep the child comfortable, treat their pain, talk to your doctor about magic mouthwash if it's appropriate, do lots of hand washing, isolate sick people, especially away from people that may be immune compromised, like newborns and elderly people. And if you have any questions at all and you're concerned about dehydration, make sure you reach out to your pediatrician. And you guys can ask any questions on here that you have for me. I hope that you've enjoyed this talk. Again, hand, foot, and mouth disease, top 5 things parents need to know. And I will be happy to answer any questions. I'd like to hear about any other topics that you all have. Throw them in the chat there for me. And again, I'm Dr. Andrea, your board-certified pediatrician and newborn expert. I teach new and expectant parents how to care and prepare for their newborns. I invite you guys to follow me on pretty much all social media at Dr. Andrea MD. That's DrAndreaMD. And then again, share this video if you know anyone that's been having questions about hand, foot, and mouth disease, or like you, Lauren, has experienced it in their family and don't know that unfortunately adults can get it and it can happen again. So this way you'll be more prepared and what you're to look for. You can get your child into the doctor early. Thanks again, everybody, and have a great night.